According to the National Institute of Health, lower back pain is a leading cause of disability worldwide. But how can you tell if it's actually your back?
Well, that's why we've got Dr. Bill from Paradigm Physical Therapy here to explain what exactly we're looking for. Dr. Bill, good morning.
Good morning. How are you doing?
Doing well, doing well.
So a lot of times people will say I've got low back pain or I've got back pain when it might actually be hip problems, okay? So hip problems and low back pain are very difficult to distinguish for the lay person. So back pain typically will be in the low back and go down the back of the leg, okay? And you might have some weakness of the lower extremity. You also may have some loss of sensation or some tingling, what we call paresthesia. It's a big word, but it's early in the morning. I just barely was able to say it. So, or you can have loss of reflexes. Now, reflexes is when you tap your tendon and your leg kicks, okay? And so those indicate low back pain. Mm-hmm. Now, in hip problems, usually the hip will be painful in the front of the hip and down the thigh. And you'll have a limp, or you'll have loss of range of motion and difficulty with lifting your leg. And it's important that as clinicians and medical professionals that we are able to discern between hip problems and back problems, because each are treated differently.
So if they're treated differently, how do you kind of determine whether one's a hip problem or back problem? You mentioned kind of the difference in where you feel the pain, but how would you know?
Right, so first of all, history. We've got to get the history of the patient, what's going on, what's happening with them. Second of all, I do a very in-depth evaluation to find out, is it more hip or is it more back? And then if there is a reason, I will perform a musculoskeletal ultrasound, which is taking an ultrasound wand and looking at the hip itself. It's really incredible. You can see the hip with ultrasound and find out if there's things like bursitis or tendinitis or tendinosis, or is there arthritis. You can see all of this with musculoskeletal ultrasound. On the back, though, I can perform an electrodiagnostic test, especially if there is weakness in muscles or diminished sensation or a diminished reflex.
And Dr. Bill, how do you treat hip and low back issues?
So it sounds like they're pretty much the same as far as how we treat them. Of course, I do dry needling, and dry needling, it gets people go, oh my gosh, he's sticking a needle in my body. It's not that bad. In fact, most of my patients find it soothing. So I do dry needling, and then of course manual therapy. With the hip, the manual therapy is different than with the back. And then the biggest thing is education, letting people know what they need to do at home, letting people know how bad their problem is, letting people know that they're not a surgical or they are a surgical candidate. Those are things that help out with a patient. And most of all, it's usually with these problems, you got to lose weight.
Well, some great options there, Dr. Bill. Of course, if you're having hip or back pain, see them there at Paradigm Physical Therapy. Dr. Bill, thanks so much for being here today.
Thank you. Appreciate you.